Hey cellmates, welcome to our YouTube channel. Don't forget to subscribe, like, and comment. What's up cellmates? Welcome back to another video.
Not ready for that.
It's our second week of recording. We're sticking, hold up. Did we do something last week?
Yes.
We're sticking
Yes,
to
we
the
did.
schedule. The only thing is, I gotta actually put the videos on YouTube. But still, we sticking to the schedule. We're supposed to do a yoga video, but our living room is in shambles, so we won't be able to do that right now. I'm not going outside because it's hot today. It would have been like,
It's crazy.
it actually would have been a good day to go out there and do yoga today.
Yeah, because it's hot, but it's not too hot. But tomorrow's stuff like 86.
In this video, I'm going to be talking about my experience with Oxbryta. If you don't know what Oxbryta is, it is a medicine that was recently developed to help manage sickle cell. If I'm not mistaken, it's supposed to attach more oxygen to the blood cells so they'll sickle less or something like that. It's supposed to help with the sickling. Look it up. It's supposed to attach more oxygen to the red blood cells, if I'm not mistaken. Supposed to like lessen the severity of your crisis, the severity of your pain. Supposed to increase your hemoglobin, which it did do that. My hemoglobin didn't went up too much. Like it went from like a 7 to an 8. 8.5, 8.7 sometimes. It's even gone up to a 9, but I haven't seen that in a while. But yeah, when it comes down to like my labs, like my hemoglobin, my rectic count, my platelet counts, and things like that, it definitely helped to increase those numbers, and I do have less severe sickle cell crisis. I do have chronic pain, so I still have pain every day. I don't know if that is ever gonna go away, like, because we know with time sickle cell breaks down your bones, your bone density, and it kills the tissue and it messes with your organs and stuff like that. So like I have damage, I have bone infarcts, so I don't know if the chronic pain will ever stop. Right now I'm dealing with pain in my spine and my hip. But as far as sickle cell crisis, aside from when was I having that crisis? Yesterday, day before. Aside from the past couple of days, I haven't had a sickle cell crisis in a long time. I would say a couple of months even. But I have still, like I said, I still have chronic pain, and because of the weather, it being cold one minute, hot one minute, whatever the weather change, I have been having an increase of my chronic pain has been a little bit more severe than normal. But it's still manageable. I'm still able to function and stuff like that. So I count those as wins within the losses, because that's what you got to do with sickle cell. Did you find the information yet?
Oh, I was on.
Oxbryta is a prescription medicine used for the treatment of sickle cell disease in adults and children 4 years of age and older. It is not known if Oxbryta is safe and effective in children with sickle cell disease below 4 years of age. Okay, this says Oxbryta helps hemoglobin do its job by interfering with the very first step in the sickling process, polymerization. By impacting this very first step, Oxbryta may reduce sickling and hemolysis, which is the breakdown of red blood cells that can lead to anemia, which is having too few red blood cells. Not me being able to pronounce polymerization, but not hemolysis. Crazy. When there are fewer sickle cells and less hemolysis that could lead to anemia, this may result in more healthy red blood cells to allow hemoglobin to carry oxygen throughout your body. So it helps to increase the oxygen that is going throughout your body by uh, reducing the sickling of the blood cells. Oxbryta is the first of its kind tablet that addresses sickle cell in a different way by working directly on hemoglobin to interfere with the process that causes red blood cells to sickle. That's basically, you don't really need to know a whole lot more. But there was a study going around called the Hope study. Well, probably like 4 or 5 years ago when that study first started. So I signed up for the study because I was struggling with keeping my hemoglobin um at the baseline. I couldn't even keep it at the baseline, which is 7. I kept getting sick. I kept getting infections and stuff like that, and it was affecting my hemoglobin, even to the point that I ended up with a plastic crisis, which is when your bone marrow stops creating blood. And my hemoglobin had dropped down to probably like a 3.4 or something like that. So I ended up having to be admitted to the hospital, and I kept having issues with my hemoglobin, my rectal count, my platelet count. They were lower than they should have been. Pretty much kind of like a scary type of low. But so what ended up happening, I was on hydroxyurea when I first started having these problems. So at first I thought that was the problem, but my my hematologist told me that hydroxyurea wasn't causing my hemoglobin to drop, but it was causing it to stay low when it dropped. Like whenever I got sick and my hemoglobin would drop, hydroxyurea was making it stay at that level rather than helping to increase it. So I had to get off of it. And then coincidentally or miraculously, whatever you want to say, this study has started. The GBT, which is global, global blood therapeutic something. GBT was funding the study. I think they were funding it on Oxbryta. And my doctor told me about it, so I decided to join the study. And as soon as I started taking it, you could see you could see it working or whatever. It didn't take a whole lot of time for me because my hemoglobin was like, we were struggling. And so as soon as I started taking it, you could tell. But it was a study, so you don't know if you're getting the actual medicine or if you're getting what do you call it? A placebo. But you could tell that I was getting the actual medicine because my hemoglobin had changed so much. Like my levels, my hemoglobin, my rectal count, and my platelet count, because all of those things dropped. You could tell that I was getting the actual medicine. But when I was in the study, I had to take 5 pills, and these pills are pretty big. I got the bottle. I don't think is it in the pharmacy? For right now, I get it from the MUSC pharmacy. Let me make sure my information ain't on here. It is. I ain't want anybody to see it. Now I get it from the MUSC pharmacy, but I was getting it from the CVS specialty pharmacy, and they were mailing it to my house. And GBT, I think, was covering the cost until my insurance started covering it. Now I just have to pay the $3.40 copay. I don't know what's wrong with my brain. I feel like my words are moving fast in my head and they're coming out slow through my mouth. But I only had to pay the $3.40 copay. But now I'm getting it through the MUSC pharmacy. It's pretty much the same thing. They still deliver it to my house, and I still only have to pay the $3.40. But this is how the bottle looks. I don't know if you could get it from any pharmacy yet. I think you still have to. I don't know how it's set up, honestly, so I'm not gonna say. But this is how they look. YouTube hands. This is how they look, and I ended up having to take 5 of these, and I think the pills were bigger when I was doing the study. I ended up having to take 5 of them during the study, but now I only have to take 3. Also, I want to note that when I was in the study, you could definitely see a difference in my levels, but when I started to get the medicine after it was approved, the difference was a lot better. Like, it was just helping with my levels when I was in the study, but I don't know what happened. Like, if the potency is different now or whatever, but now I was seeing improvement in my levels, but I wasn't physically feeling the improvement. However, now I feel it. I feel the difference. Of course, with sickle cell, you still gonna have your pain. You still gonna have low energy and stuff like that, because that's just how sickle cell is. But I do have less crisis, and my crises are less severe, and that was important because I was having crisis back to back. I was having very severe crisis. Like, I was going through it basically with sickle cell. But ever since the medicine got approved, and I've been getting it, things have been getting better for me. Like, I ain't gonna say it hasn't been a whole year yet, because 2020 was rough. But after, I think, like June, July, as soon as I switched over to getting the medicine from CVS Farm, as soon as I switched from the study drug to the approved drug, I started feeling better physically. Like, I could feel the difference. Like I said, I don't know if they changed the ingredients or what, or the potency different or what. But for the first half of 2020, I was struggling. Then I got switched over, started taking it, and then I started seeing good results. And ever since then, I've been doing pretty good. Like, I've been able to function. I did get crisis. I haven't had one in the past couple of months. Well, I haven't had one aside from a couple of days ago in the past couple of months. Before the one that I had a couple of days ago, I haven't had one in the past couple of months. So that's a good thing. But like I said, chronic pain is still here. I still have damage from sickle cell, so I'm still going to have pain every day until I don't. What else do I want to say? I honestly don't know how they're doing this now or whatever, if the doctors are offering it to all of the patients or whatever. But if you're interested in, like, trying it out, I feel like it's worth a try, especially if you have been consistently having a hard time with sickle cell, whether it's the pain or, I won't say that it boosted my energy, because I would be lying. It didn't. I'm still tired. And also, keep in mind that I'm somebody who makes suffering look good. And I also dumb down a lot of stuff too. This medicine did help me feel better. That's not like an exaggeration. I do feel better. I'm able to function because, like I said, the first couple of months of 2020, I was bedbound most of the time. And it wasn't just, physically, I was going through things with sickle cell physically, but also mentally. Like, when you've been sick for a long time, it's kind of hard to pull yourself out of that mentality and, like, that fear-based, that paranoia that we get when we feeling good for a little while, and then you scared that sickle cell just gonna come out of nowhere and hit you. I don't really have that paranoia now, and sometimes I even forget that I have sickle cell. Not because I don't have symptoms, but because it's not as bad as it used to be. Okay, when a sickle cell patient say that they feel better, keep in mind that better for us can be a slight increase, a slight difference. It does not mean that I'm cured. It does not mean that I'm able to perform differently or whatever. It just means that I feel better. I got some relief. You know, I still have pain every day, but I got some relief. I don't have sickle cell crisis every day, or I don't have them as frequently as I was. Because I would have a crisis, be having a crisis for like 2 weeks, get better, a couple of days, and then I would have another crisis. So yeah, it's not like that now. I just have to deal with chronic pain. What else? What was I saying? I was just saying, keep in mind that when a person with sickle cell says that they feel better, that doesn't mean that like we're normal. It don't mean like that we feel like able-bodied people. Better for us. But like I was saying, I don't know how they're going about getting it to sickle cell patients. So if you want to try it out for yourself, I would say ask your doctor about it. The name of it is Oxbryta or Voxelotter or something like that. I'll put it on the screen. But yeah, ask your doctor about it and ask them why didn't they tell you about this medicine. They also have one that they recently approved called Adecveo. It's an infusion. It's an infusion treatment that you get for sickle cell, and I know someone who is on it, who's also had a pretty good results from it or whatever. Having sickle cell, managing sickle cell is hard, and we can get all the help that we can get, honestly. I know trying different medicines and stuff like that makes you nervous for obvious reasons. It makes me nervous too, and I'm not just gonna sign up for something just because, like, I'm not one of those people that are desperate to be normal, if that makes sense. Like, I can accept the fact that I have sickle cell and I might have issues with it all my life or whatever, but I'm at least going to try different things to help me out, because I don't like not being able to function and not being able to do a lot of the things that I want to do or that I like to do. So that is why I decided to sign up for this the study when it was open, and it just was perfect because I was going through it. Like, I was going through it and I had good results. Of course, with any study drug, you will have to be on birth control. If you're a woman, birth control. If you're a guy, using birth control, using condoms and stuff like that, because they don't know how it can affect your kids or whatever. I'm not on birth control right now, because I'm not on sex right now. I've been off of sex for a while, so yeah. I don't need birth control. Don't feel bad for me. It's by choice. I mean, look at me. Psych. But yeah, this is my experience with Oxbryta. I do think it's worth the try if you are someone with sickle cell and you're struggling with managing your sickle cell. Definitely ask your doctor about it and get more informed. Don't just listen to what I say and then be like, okay, yeah, I'm gonna try it. Inform yourself. Go look it up on Google. Go ask your doctor. Talk to a specialist if you need to. And if I have the information, I'll leave it in the description of this video right here, so you can, try it for yourself. But that's the end of this video. Thank you for watching. We will... What's the next? Oh, we can do this one too. Oh, okay. we ain't got no mukbang though.
Yeah. I got 15 minutes.
Oh, yeah. Well, thanks for watching our video.
You do tomorrow.
What?
You do it tomorrow. Oh, tomorrow Thursday.
Mukbang tomorrow. Oh, I'm doing a photo shoot tomorrow. Oh. For my Patreon. So yeah, I'm trying to make some money. So we'll just do it next week. Okay. So we gotta remember It's a mukbang. Doritos, we gotta buy food. Yeah, that's next week, Wednesday.
Okay.
Thanks for watching this video. Don't forget to subscribe, like, and comment. And we will see you in the next one. Bye. Don't forget to comment, like, and subscribe. To learn more about us, visit our website at cellmatesapparel.com.